Good day everyone, and this is the continuation of our topic about sexual life. We have what we call triangle theory. As what Dr. Stenberg said, love is made up of three components. We have intimacy, passion, and commitment. The importance of each component of love, according to Dr. Stenberg, differs from person to person and couple to couple. For the perfect romantic connection, these three components are important. Although the degree of each component required tends to vary from one relationship to the next and even over time within a relationship. Knowing how the components work together will help you discover situations where you can improve. Recognizing that your relationship's passion has faded. For example, it can help you explore for ways to rediscover the spark. The first one is liking or intimacy. This type of love exists when there is intimacy or liking but no feelings of passion or commitment in the romantic way. Ito yung parang gusto mo lang siya because you just like that person. And ang example dito is friendship. Next one is infatuation. Passion. Infatuation is defined by lust and physical desire without liking or having a commitment with that person. There hasn't been enough time to build a deeper relationship of trust, romantic love, or consummate love. Parang gusto mo lang siya dahil maganda siya or sexy. Gusto mo lang siya dahil gwapo siya at may abs. And ang example dito is yung mga crush natin. Next is empty love, commitment. Commitment without passion or closeness characterizes empty love. A passionate love can sometimes turn into an empty love. Pwede mo rin namang baligtarin. Ang empty love can sometimes turn into passionate love. Ang example nito is yung arranged marriage nga. And alam nyo naman yun, di ba? Yung mga bago lang ng babae at lalaki ay pinagkasundong ikasal at may mga kasabihan na para daw masalba ang lumulubog na kumpanya or dahil isa sa kanila yung solusyon para mabayaran ang napakalaking utang ng mga magulang ng isa sa kanila. But in this type of love, there is a possible way na kahit hindi nyo gusto or mahal ang isa't isa ay may possibility na magustuhan nyo. Next one is romantic love, passion, and intimacy. Romantic love emotionally involves bringing through intimacy and physical desire. And in this form of relationship, partners engage communication that allow them to learn things about one another. Ito yung mga ginagawa ng mga nasa talking stage ng mga tao. But not all talk na may ka-talking stage is nagtatagal, diba? I mean, to those person lang talaga na super interested na malaman ang buong buhay mo. And also, they are captivated by sexual passion and affection. And these couples may be at a crossroads in terms of long-term commitment or future goals. Next one is companionate love, intimacy, and commitment. Companionate love is a kind of love that is intimate but not passionate. It includes the triangles, intimacy, or liking component as well as the commitment component. It is more stronger than friendship since it involves a long-term commitment but little or no sexual desire. And this type of love is common in relationships where the passion has gone but the pair still maintains a strong bond or deep affection for each other. This can also refer to the love shared by close friends and families. Next one is faucious love, passion, and commitment. Commitment and passion are included in this type of love, but intimacy and liking are not. Yung madali ang panliligaw ang nagre-represent ng passionate love. Parang gusto mo lang ng commitment ng isang tao sa isang tao kasi siguro hindi ka sanay na mag-isa. Gusto mo lang na may kausap, may kalambingan, ano pa nga ba, yung may susuyo kapag nagtatampo ka, pero you're not into him talaga. Yung parang husto lang kayo sa landian, tapos you didn't do such effort to learn some things on her or him na pwede nyong gamitin to improve yourselves. Ganun. And yun nga, as what I've said, in which desire drives a commitment without the stabilizing influence of connection. Kaya medyo confusing to kasi you should be so you should be so irresponsible after witnessing this type of love. And minsan when it comes to marriage, may ganitong klase. And we have the last one, which is consummate love. Passion, intimacy, and commitment. Consummate love encompasses all three components. Yun nga sabi ko, passion, intimacy, and commitment. And it is the most complete type of love. It symbolizes the ideal love. Ito yung mga taong super green flag when it comes to relationship. Couples who have this kind of love have a good sex life even after a long time together. They can't imagine themselves being tied to anyone else. And ito yung mga taong sure na ikaw lang at walang iba. They can't imagine being completely happy without their partners either. Mga taong in love talaga. They are able to work together to overcome conflicts and deal with pressures, yung kahit anong sakit, problema, or kahit anong bagay na ibigay nyo sa isa't isa, still pipiliin nyo pa rin na magstay at ayusin ang problema. And sa lahat ng nabanggit ko, yun yung mga types of love psychology. And according to psychology of love, there are psychological theories that explain why people fall in love. And ang first one doon is behavioral reinforcement theory. Yon. A lovely feeling may be felt when someone receives a gift from someone, like kapag inaya ka niya ng road trip, or maybe he treats you food, or that person shows something special on you. Ganon. And syempre, as a person na kulang sa kilig, ay talagang kikiligin. I mean, parang makakaramdam ka ng kilig kasi nasa isip mo, ang special ko namang tao for this experience. Ganon. And the better the feeling connected with the person's behavior, the more likely that behavior will be continued. Yan. And we have the second one called sociological arousal theory. This explains the most often used explanations of emotions. First, the bodies experience a sociological change, and then people label them as an emotion to that physical sense. It is based on the brain's interpretation. For example, nakakita ka ng malaking ahas, takot ka dun. Ano magiging reaction mo? Alam mo namang matutuwa ka. Syempre hindi, diba? Probably matataranta at kakabahan ka. And the brain would identify that emotion connected with his experience as fear or takot. Another scenario, nakita mo yung crush mo and you will have the same experience. Like nung unang example na sinabi ko na nakakita ka ng ahas, what reaction would you feel? Diba same pa rin? Matataranta at kakabahan ka. But in this scenario, the brain would read the situation differently, and that's the feeling of love. The third one is evolutionary theory. This explains how love developed as a result of sociobiological necessity. Like yung mga lalaki, mas pinipili nila yung mas batang babae. And minsan, di ba minsan may tawag doon? Ano yun? Pedophile. Di ba? And mas pinipili din nila yung mga healthy females to just carry their babies. Well, sa mga babae, mas prefer nila yung mga mala sugar daddy tao na mga mas older sa kanila because they are financially stable na tao. Or pwede rin naman kaedadan natin, but financially stable person pa din. But they have reason din naman. Some females are practical lang, that's why they prefer males who have financial. Syempre, to support them and their children. And based on social psychological data from Rosenthal 2013, the factors that would determine with whom people fall in love are: the first one, physical attractiveness, or though beauty is in the eye of the beholder. Second one is reciprocity, or people tend to like an individual who also like them. Third one is proximity, being around anytime physically or virtually. And the last one is similarities, same age, religion, education, race, physical attractiveness, intelligence, and socio-economic class.
The diversity of sexual behavior. Not all sexual arousal results in sexual activity. Humans are continually exposed to sexual stimuli when they see attractive people or advertisements with sexual themes in the media. For example po sa mga televisions, sa mga social media accounts, ganun. There is solitary activity which involves only one person, and social sexual behavior which involves more than one person. Sociosexual conduct is broadly classified as heterosexual, male with female, or homosexual, male with male or female with female. Of fact, if 3 or more people are participating, heterosexual and homosexual action can occur at the same time. The term deviant should not be used as a moral judgment, but rather to indicate that such behavior is uncommon in a given society. Because human communities differ in the sexual behaviors, what is considered deviant in one group may be normal in another. The term deviant can refer to both solitary and sociosexual behavior. Solitary behavior, it provides pleasure for self with emotional content with sole control to the degree of pleasure. This behavior is more common in males, and there is great individual variation in frequency. Solitary behavior, parang ang pinaka-example po niyan is kaya yung tinawag yung sa parang males are common in this behavior is that yung kapag ka po may person na alone sa bahay or mga bird like that po. According to Rosenthal 2013, on the other hand, describes sexual orientations as a person's predisposition or inclination towards sexual acts, emotional attachment or physical attraction to one or more sexual partners. The term sexual orientation is preferred over sexual preference, which suggests a purposeful or conscious choice of a sexual partner. Sexual orientations are classified as follows. So, dako naman po tayo sa sexual orientation, which has 5 orientation. The first one is heterosexuality. It is the attraction to members of opposite sex. Meaning, ito po yung pangkaraniwang parang boy to girl, girl to boy. Yun po ang meaning ng heterosexuality. Next is homosexuality. It is the attraction to members of the same sex, which is lesbian, the term used to describe a woman who's sexual and romantic attracted toward women, while gay is a man whose sexual and romantic attraction is towards to other men. Sila naman po yung tinatawag nating bakla or tomboy sa ating parang sila po yung kung baga sa parang sila yung opposite. The third one is bisexual. Is a person who may be sexually oriented to both men and women. Bisexual naman po is it's either pwede siya sa lalaki, pwede siya sa babae. Depende kung saan niya gustong ma-attract, katulad po ng, kunwari, for me, I'm a girl. Pwede kong magustuhan yung babae na gusto ko, or pwede kong magustuhan yung lalaki na gusto ko. Depende sa choice ko. The fourth one is transsexual. A term used to describe people who identify as having a gender identity that is not congruous with their assigned sex and who desire to permanently transition to the gender they identify. One of the example po is yung kay Jake Cyrus, or yung kilala po natin dati sa pangalan na Charis Pempenko, which nagpa-transgender po siya to look more like a man. Lahat yung parang dito po papasok yung sa mga plastic surgery, like that po, yung mga pills na iniinom para maging boses lalaki or para tubuan ng mga different sa mga katulad po sa kilikili, sa mga bigote, like that po. At ganun din naman po sa babae. Karaniwan nga lang po sa mga babae yung mga transplant. Yan. Lastly is pansexual. Pansexual is a new sexual orientation of persons who are sexually attracted to people regardless of gender or gender identity. Pansexual naman po is like yung parang mga bisexual din. Nire-regard na po nila yung pinaka-identity ng isang tao as long as mahal niya yung isang tao, even though sexual siya, kung ano man ang choice niya, yun na yun. Parang wala siyang pinipili. Basta kung anong gusto niya, yun na yun. Kahit babae to babae or babae lalaki, katulad nung parang kahit ako. Kunwari tomboy ako, pero ang gusto ko bakla yun. Ganun po. Ngayon, dako naman po tayo sa sexually transmitted disease or what we call STD. Sexually transmitted disease are infections that are passed from one person to another through sexual contact, blood transfusions, breastfeeding, and a certain amount of saliva. These infections are also known as venereal disease or sexually transmitted infections or STI. Some causes of STDs are bacteria, parasites, yeast, and viruses. These STDs can be dangerous, although in today's generation it can be treated in different ways, but if not, it can lead to human immunodeficiency virus or what we call or as known as HIV or even acquired immune deficiency syndrome or acquired immunodeficiency syndrome or what we call AIDS. HIV or AIDS. HIV stands for Human Immunodeficiency Virus, with AIDS stands for Acquired Immunodeficiency Syndrome. Thus, HIV is a virus while AIDS is a condition or syndrome. HIV can lead to infections that attack and destroy the CD4 T cells of the immune system, which is the body's natural defense against such illness as tuberculosis, pneumonia, and cancer. Antiretroviral therapy or ART is a combination of medications that are used to prevent HIV from replicating. It helps those with HIV positive to live longer and happier. ART is not a cure but it does reduce the risk of advancing the condition into AIDS. Para po mas maintindihan natin ng malinaw kung ano nga ba yung antiretroviral therapy, siya po yung parang sa mga psychology na nakikipag-usap sa mga may mental katulad na lang po kunwari depressed, para pong sila yung tumutulong sa kanila para mabawasan yung depressed. Parang yung antiretroviral therapy, parang ganun po siya. Yung pinapagaan lang po niya yung mental health natin. Yan. Next is gonorrhea. This is a sexual transmitted infection caused by bacteria that thrives in the moist mucous membranes linings of the mouth, throat, vagina, cervix, urethra. Gonorrhea is an infection caused by a sexually transmitted bacterium that infects both males and females. Gonorrhea most often affects the urethra rectum of throat. In females, gonorrhea can also infect the cervix. Gonorrhea is most commonly spread during vaginal, oral, or anal sex, but babies of infected mothers can be infected during childbirth. In babies, gonorrhea most commonly affects the eyes. Next one is syphilis. It is a sexually transmitted infection caused by bacterium Treponema pallidum or Spirochaete. If left untreated, syphilis may progress through 4 phases with symptoms ranging from country sores or general skin rashes to liver damage and even death. The next one is genital herpes. This is a sexually transmitted infection caused by a wide family with different strains. Other non-sexually transmitted diseases caused by these strains include chickenpox or mononucleosis. Genital warts, also called venereal warts or condylomata acuminata, are caused by human papillomavirus, a virus related to that one that causes common skin warts. Certain high-risk types of HPV can cause cervical cancer and other genital cancer. Ang genital herpes po parang sa family siya. Parang kumbaga it runs in their bloods. Parang genes. Parang nakukuha na po yun sa ganun. Next is chlamydia. This is one of the most common sexually transmitted infections named for Chlamydia trachomatis, an organism that spreads through sexual contact and infects the genital organs of both sexes. Chlamydia is a common STD that can cause infection among both men and women. It can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant. Chlamydia can cause a potentially fatal ectopic pregnancy or what we call yung parang pagbubuntis sa labas ng womb. Ganun po.
Dako naman tayo sa methods of contraceptions, artificial and natural. People use contraception for a lot of different reasons. Some of the goals of birth control are to avoid pregnancy, and many women choose contraception for personal reasons. Some hormonal birth control techniques, for example, may help regulate your period, minimize acne, and or lessen endometriosis-related pain. In general, contraceptive use includes consideration of aspects other than medical safety. And before considering contraceptive methods, a person must be given the ability to express their concerns and freely choose whether they wanted to prevent from pregnancy or STI, HIV. And may iba't iba tayong methods ng contraception. Una, hormonal method of contraceptions or prevents the release of an egg or ovulation. Letter A, we have oral contraceptives or pills, and it relieves period pain and bleeding and may help with premenstrual symptoms. In some cases, missing pills, vomiting, or severe diarrhea can make it less helpful. Next one is the patch. It is a small patch that you put to your skin that produces estrogen and progestogen, stopping ovulation. It can make bleeds more regular, lighter, and less painful. However, it might be seen and cause skin irritation kasi nga kumakapit yung patch sa balat ninyo. The third one is the ring. The contraceptive vaginal ring is a small plastic ring that a woman places through her vagina every month to prevent ovulation. One ring lasts 3 weeks, so you don't have to think about contraception every day or wear it all time. Next one, we have implants. A small flexible rod is placed beneath the skin of the upper arm and is kept in place for up to 3 years. Yan. Next one, we have injectable. Progestogen injection. It is effective for 8 or 13 weeks and reduces the need for contraception during the whole period because it cannot be removed from the body. Side effects may occur both during and after the procedure. The second one method is we have barrier methods. Method that physically or chemically block the sperm from reaching an egg and provide a barrier between direct skin-to-skin contacts. And we have diaphragm to cover the cervix. A flexible latex or rubber or silicone device containing spermicide is put into the vagina. It can be taken before or after physical contact. Next one, we have cervical caps. These are similar to diaphragms in function, but are nearly always made up of silicone. When used correctly, they are 92 to 96% effective and useful at covering the cervix when placed in the vagina. Last one, the common thing. Ito yung mga binibigay sa barangay o kaya ng school. And these are what we call male and female condoms or spermicides. Males get a very thin latex or rubber, polyurethane or plastic or synthetic sheet put over their private parts. Sa females naman, a soft thin polyurethane sheet that loosely covers the vagina and the area just outside the vaginal opening. Condoms are the most efficient technique of preventing sexually transmitted diseases. And we have third method, and this is what we call behavioral method. The letter A is the rhythm or calendar method. It is a way of finding woman's most fertile and infertile times by monitoring her menstrual cycle. And it is also known as natural family planning or fertility awareness. Letter B. Abstinence. The avoidance of sexual intercourse is sometimes referred to as celibacy. Next one is outer course, a sexual act in which the male private part does not enter the female private part. Next one is withdrawal. It occurs when a man removes his manhood from his vagina and ejaculate outside of the female body. And the fourth method or the last method is sterilization. Procedures that make an individual permanently incapable of conceiving or fertilizing a partner. And we have tubal ligation or sterilization. It is a female surgery in which the fallopian tubes are tied to prevent eggs from traveling to the uterus, preventing a woman from being pregnant. Vasectomy. Yan. It is a surgery in which the surgeon makes a small cut in the upper part of the scrotum and plugs or blocks the vas deferens. And after the operation, men might still have orgasm or ejaculate. Next one, we have intrauterine device or IUD, a small device inserted in the uterus by a doctor to prevent pregnancy. By the way, the sterilization pala is not the last method na contraceptive or contraception. Yun nga, mayroon pa kasing 5 or 6. And yun nga, last one, we have emergency contraception, a method of preventing pregnancy when unprotected intercourse has already happened. It could be through an IUD or a higher pill dosage. And that's the end of our discussion about sexual life. Again, have a good day and thank you for listening.